Welcome back, Taking Chances viewers. It's your boy Justin.
And Burnett.
Now, you may have noticed that for this episode, we are missing 1/3 of our Taking Chances team. However, we promised to make sure that we carry Q Spirit on this episode. I am actually really excited for this one, guys. This season has been all about wellness. We are continuing our conversation about the overall Black wellness, and as well as our conversation that we started earlier in the season about the overturning in Roe versus Wade. You've heard from the guys, you've heard from the girls. My lovely co-host Burnett has brought another area to our attention that I kind of feel like is really super amazing. It's a Taking Chances first, and I'm just really excited to get in this conversation. So I'm going to turn it over to Burnett to kind of give us a little bit more background on the way we're going to go with this one.
So today's episode is Things Get Clinical. We have a sit down with Dr. Angela Meikle. And for those who don't know, this is actually very special because Dr. Angela Meikle is the mother of Jasmine Michelle, who you guys may have seen on season 3, episode 1's episode of Black Love. So we actually have this is the second time we have a parent-child duo going on. So this is going to be really interesting, and you guys are in for a treat. So before we bring Dr. Meikle in, I just want to go through her bio real quick, let you guys know what we have to offer tonight and all that we're going to be talking about. So Dr. Angela Meikle was born in Tobago, West Indies, but she was raised in Brooklyn, New York. Yes, Brooklyn, you know. Yeah. And she has a multitude of degrees. So Dr. Meikle is highly educated. Okay, so we're going to start off with her first degree. She has a Bachelor of Science from Cornell. Okay, from Cornell.
University.
Yes, and then she went on to pursue her master's in business administration from SUNY Binghamton. Yes, number 2. Okay, we're not done. We go on to SUNY Syracuse, where she received her doctorate in medicine. So now, what does she practice? She's an OBGYN, and she has been providing these services since she completed her residency in 2005. She's a provider of women's health services. She works in a local community clinic providing abortive cares, general obstetrics, and gynecological care. She's also the director of prenatal services, and she manages contraception, hormonal changes, preventative care, and surgical GYN services. So with that being said, without further ado, we are going to bring on Dr. Meikle.
Welcome.
Hello, how are you doing?
Great.
Pleasure to be here.
It's such a pleasure to have you, Dr. Meikle. I'm really excited about tonight's episode, so this is going to be good. It's going to be good. So first, just to start off, I think that this is an impressive field that you decided to take up, but I kind of want to get into how and why you chose to specialize in gynecological services.
Well, actually, it's not really that deep. When I went into medicine, I was going to become a pediatrician, right? That was, kids are cute. I like to be, around the kids. But when I actually did my residency, I had the most fun when I did my OB round. So when I was doing the obstetric round, I knew everybody in that room. I knew the patient, the husband, the father, the auntie. I knew who they were going to name the baby after. Oh my gosh, I had such a ball. I was like, hey, this is cool. Then we also had the surgical side of it. So it's kind of one of those things, well, yeah, we're primary care, but we also get to do surgery and it's women's health. And I said, I can do that. And then that's kind of when I made the switch. So when I went in, it wasn't anything deep like, oh gosh, no, nothing like that. It's just, I had the most fun, but I was like, I could do this.
Yeah.
And it turned out to be, very good because I'm very deep into women's health. And this is just an avenue for me. And I said, you know what, I can expound upon this. And this is running, took it up and just went.
Mm-hmm. So with all that's been going on in the country right now with women's reproductive rights, it's a lot of uproar over the overturning of Roe versus Wade. I know that you practice in New York, so I'm just curious as to what some of the legal implications may be of the overturning of Roe, if any, for you. Has your practice changed at all? Have you noticed anything different?
Well, I actually work in a termination center, so it has impacted us quite a bit. Now, because I'm in New York, it's still legal. But then we have people coming from across the border to get services, upstate, Florida. I mean, they're coming from all over because they don't know whether or not they can get this done. And with Texas, they all had that snitch law a while back where, you could basically tell on someone who went to get a termination. And we're seeing a lot more people coming in. Even here, people who are here, they don't know because, yes, it's legal in New York, but they don't know if next month it's going to be legal. So a lot of them are coming in earlier and earlier for the terminations, and sometimes coming in not even with a documented pregnancy. We're like, well, you're not pregnant, But they're so scared that they don't want to take the chance that they're going to be left out there without a choice.
Mm-hmm.
And what I find strange is some of them, they haven't even made up their mind whether they want to do it. But the fact that they think that they may lose the opportunity to make the choice, they will come in and do it.
Wow. That's really powerful because it just shows the level of fear that a lot of women are currently facing right now. And one of the things that I've noticed, like with the legal profession, and I'm wondering if the medical profession is similar, but sometimes the lack of education can drive that fear. And so I wonder, what are the practices normally like within the medical profession? Like how do people educate everyone of like what their resources are, like where to go? I know Planned Parenthood is good at that, but that's just an organization. So are private practices what do they do typically?
To inform them of their resources?
Yeah, like what services are available to them, like.
Yeah.
Well, most offices are very multidisciplinary, so they usually have like a social worker on board or have someone in the social services to speak to the patient about what's available. Depending upon your field of practice, you would also let the patient know where they can go. Like if someone comes in and has an STD and we treat them, but their partner has no insurance, we can always say, go to the Department of Health and let them know, because sometimes they're unaware. Because we can't have the partner not be treated because it doesn't make any sense. Sometimes you let them know because a lot of it is social service in the sense that, let's say they're in an abusive relationship. I can't really do anything for this person other than make sure that they're healthy. But then we get them in touch with a social worker who could help them get into a shelter, help them get food. So we educate them. We have our mothers. We taught them there's breastfeeding courses. We have nurses that would go and help them with the babies, especially if they're the first time mom. So a lot of things that we have that we know that are out there, we can always disseminate that information to the patient. And then when you get to bigger units like a hospital, they have different facets, and everyone is taking a sort of like a bite out of this and says, okay, we can help her, we can help you maneuver the stairs, we can help you get into a place where you're on the ground floor, we can help you with someone coming in and help you take care of the baby. So there are lots of different resources, and we let them know by just telling them.
Do you find that most of the day-to-day things your day-to-day things you'll work on now has changed pre Roe versus Wade overturning?
Well, it's not so much different. We have now that, because of COVID, not so much the decision, that now they're trying to do, I guess, medical terminations at home, which I have issues with. And you have a lot more people who are trying to get this done. So if they can do it at home, they don't necessarily have to even travel into New York. The problem then is that, so who's watching you? And I kind of find that a lot of the restrictions become a little bit more lax to just give everybody the opportunity to have the procedure done so that it's not limited, and to get more people to get it done. So we try to, to give people the best care, but sometimes we have to maneuver around these legal blockades so that everybody gets what they need. So I personally don't, because again, I don't work on the termination side, but I do feel that we get a lot more people coming and wanting to know about the medical termination and how to do it at home. Yeah, that's the one thing I found. In New York State, you could legally have a medical termination up until 23 weeks and 6 days. That's because at 24 weeks, the baby is considered viable, meaning that if this baby were to be delivered, it may survive. Okay, so that's considered survival. So it's the 500 grams or 23 weeks and, well, 24 weeks actually, that you can get it done. So people are going to try to see if they can come in earlier. I don't see very many people coming in once they've decided that they're going to continue pregnancy to change that. The biggest problem I'm seeing is the people who are concerned that they may not be able to do this next week, 2 weeks, a month later, because they don't know whether or not the law is going to still stand.
Are abortion pills common in your practice? I've been hearing a lot about that, where people have been trying to get them mailed or get prescribed for abortion pills.
Well, we don't actually mail them. They come in still to our office. So up until 10 weeks and 0 days, you can do a medical termination, which is done via tablets. So you have the privacy that you could come in, you get the one tablet here, and you get the other 4 tablets for you to go home with. And the surgical, anytime up until, again, the 23 weeks and 6 days, you get the surgical. So once you've passed 10 weeks, you have no option but to do the surgical.
Got it. I actually wanted to talk with you about a case study. Was quite disturbing, and it became almost like embarrassing to see how some of the senators handled it, because they thought that it was a lie at first. But it was a 10-year-old girl who was in Ohio, and she was raped by a 27-year-old man. And because of Ohio's fetal heartbeat law, which was enacted just hours after the Supreme Court's ruling when they overturned Roe, she had to travel from Ohio to Indiana, and she was 6 weeks and 3 days pregnant. So, from a medical perspective, can you explain to us why this procedure was so necessary for this 10-year-old girl to get?
Well, it's not just the medical component, but also the emotional aspect of this 10-year-old. Now, I don't know what this 10-year-old looks like, but I'm assuming a 10-year-old, she looks like she's 10. So she still has a lot of sexual maturity to do. She has to develop. And so now she is going to be growing to try to get her body to grow, as well as growing something inside of her. So she's not yet mature, but yet she's growing something inside of her. So there's a lot of demand on the body. So it's not that she had to, because I think, if I'm correct, that the Guinness says that the youngest mother was 5. So the youngest mother in world record has been 5 years old. So, and she delivered the baby in the sense that she was sectioned, so she had the child.
Okay.
So it's not as though she's incapable of doing it, but it's just a lot of strain on the body and emotionally for this 10-year-old. How are you explaining to her what's going on to her?
Yeah, I mean, just thinking about it, it's really disturbing. I mean, for me, I got my period when I was 14 years old. And I mean, like you said, when you think about when a woman's body starts developing, I mean, it's just like, at first, okay, maybe the breasts are budding and, maybe you start to look a little bit more older. But at 10, like, I was still just a kid. So and I wasn't thinking about any of that stuff. I mean, in no way, shape, or form would you have said, okay, you're going to have a kid at 10. No, not in America, I wouldn't think. So to know that she went through that traumatizing experience, and then the law essentially is saying that you're expected to carry like that child. I mean,
as if she's not worth anything. She's just this container. So she's just there to house this pregnancy until it's decided to be delivered, and then get on with your life. So I'm like, no, she's probably would have been delivered via cesarean if she took that baby to term. But then she has to deal with the whole pregnancy itself. So emotionally, it's a roller coaster to deal with. You have mature women who have degrees and are educated, and being pregnant is an emotional uphill climb for them. So you want a 10-year-old to go through, especially you're telling me she was violated. So this wasn't something that she consented to. Not to say she can give consent to 10. And you're going to say, hey, you are forced to keep this child because we, the people, decided this is what we use best for you. And that's the problem. How do you decide what's best for me?
And, you bring up an interesting point, because I love the intersectionality with law and medicine. But when you think about it, right, we the people, who is we the people when the Constitution was written, right?
Mm-hmm.
This country was written by old white men. And at the time, Black people were only considered 3/5 of a person when you look at the beginning of the Constitution. So it's just an interesting thing to see how everything has shaped. And I know that it's tough for a lot of people with respect to however they identify, but it's just a tough time for a lot of people because, like you said, I mean, the laws are essentially telling you how to live. And the concerning part is I know that I think it was in North Carolina, there was some discussion about the district attorney saying that they wouldn't prosecute any doctors or patients if they did undergo abortions should, you know, the law change, making it a crime, because then their caseloads would be crazy. I mean, you'd be prosecuting doctors left and right and patients left and
Doing
right,
their
and
jobs.
it's like for doing their
Well,
job.
you know what? I think because there's a lot of common sense that seems to go out the window. And I think a lot of what the issue is just control. People like to be in control of other people. And they don't always think of what's best for them. It's all control. So they're going to now, I guess, make it illegal to do anything. So we become criminals in a sense. But then people get DNCs for other reasons. They could be bleeding. Pregnant and bleeding, they could be miscarrying. Yes, they will eventually pass everything, but you don't know how long that's going to take. So rather than have this woman bleed out and hemorrhage out, or have her bleed and pouring blood into her at the same time, do the DNC, get it done. So now they're telling us we can't do that. Like, well, medically, we have a Hippocratic oath, you know, and it's the first line, first do no harm. So we are doing a lot of harm by letting this person bleed out or letting the law dictate what's going on in the operating room. It's just as bad as having the insurance company tell us that we can't do a test to do a certain stuff because it's not, you know, feasible as far as the money is concerned. It's just as bad, the politicians and the insurance company, when everybody's coming into your world to tell you how you should live, how you should manage, what you should accept and what you should not accept. So I think personally, everything is all about control. Now you say we the people, old white men. This is not even about the old white man. This is male, female. Because think about it. As a woman, if you were to somehow get pregnant, and I've never seen a woman got pregnant by herself, ever. You are now left with that decision. Even if you had contraception and it failed, even if you decided, hey, you were unaware, whatever was going on, you were violated, you are now left with that consequence. What happens to the male? He gets to walk away. He may decide to help and save, but then you got to hold your breath and hope that he does. But he gets to walk away. Now you are stuck with this. And the part that I find very interesting about a lot of this thing is that they write these laws saying that we can't do this. But you know, who does that affect? Because the rich people will still get their terminations. And don't act as though the rich don't have terminations. They get terminations. The difference is that they now have the resources to go to find a doctor who could probably do it in his office so he doesn't have to deal with the external eyes looking at him going, oh, we saw this record saying that you did a termination in someone who was 7 weeks. Who is this? You could do it in your office. And you could say this patient had a missed AB. She had a missed abortion. So basically the fetus's demise, but it hasn't passed yet. Or we can say that she was hemorrhaging and we had to do this. So when you have people who have resources, they will get it done. It's the poor who are going to be stuck with the, oh gosh, now I'm pregnant. Now I've got to continue this pregnancy. And we all seem to know that when you have a lot of children or more children or children when you're not ready, you sort of perpetuate this cycle of poverty. So it's hard to break that cycle because now the money you would spend to say resources for you, to get your education, to even go travel, whatever you're going to do, you got to spend it on a child. So you don't get money to invest in your future as much as, and not to say the child isn't your future, but the way that you want, because now you got to spend money for the kid.
Dr. Meikle, you touched on a really interesting point that I kind of wanted to highlight a little bit on before I dive into another point that I feel like I have to speak to as a man on this call. But the first point that I wanted to kind of highlight was you talked about what I'm kind of getting from what you're saying is there's a bit of a moral compass that you have to have as a doctor within this profession. There's a moral compass of being able to make sure that the patient is getting the utmost care possible, also navigating how to deal with the ever-changing laws that go around, you know, providing that care. How do you navigate that?
Well, we have usually risk management and legal teams who would advise us. from day to day, it's not much of a difference. It becomes a problem when there's an ethical issue. Because I mean, I had a 15-year-old once who came in and was pregnant, was very proud of the fact that she was pregnant. And I was, doing my normal history. So when was the last menstrual period? Have you been pregnant before? And, I'm asking her, my history, any medication. So how old is the father? Oh, he's 27. She's very proud. 27. Oh, so what's his name? I asked the name. Really? He's 27? So do your parents know? Yeah. Because she was so happy. She was so elated that she was pregnant with this guy. So I'm like, do you realize that's statutory rape? And all doctors, regardless of just OBGYN, if there's any sign of abuse, child abuse, we have to report it. So now when I'm done with this lady and I have all information, because she wasn't hiding anything, but she doesn't see anything wrong. I go to the social worker and I said, this girl, she's like 15 years old. Her partner's 27. This is his name. He gave me his address. And I said, no. So he was reported. Next thing you know, the police came knocking on the mister's door. And now she comes in. I didn't tell you I wanted him. Ma'am, little girl, we are obliged to report this. You don't have to report anything. This is statutory, meaning that if they say, hey, you're 27 and you're 15 and this baby is yours, that's rape, right? We don't have to do anything, but we have to report it. Then she had to get it terminated because now he forced her to get the termination. So now the problem became, she's coming in for a termination. We can't deny her the service. She had to get the termination because now he wants to get this terminated before paperwork can be processed to us to get the fetal tissue to say that he's the father. Exactly. But you see, but we can't stop her because now she's coming in for termination. We can't say, no, we can't do the termination on you, right? She ended up getting the termination. I'm sure his name is somewhere, but there's no evidence anymore because all of that was done before. We can't hold the tissue for when the paperwork comes in. So we have this fine line where we have to cross. So we see that all the time. I've had patients come in and they damn near died with their last delivery. They were preeclamptic, they had cesarean, they were transfused how many units. And here they come in and the partner doesn't want to use anything. And I said, well, does she not realize you almost died? Yes. And it's kind of like, well, so he's willing to risk your life? And sometimes they tout religion, their religion say they can't do this, do that. Listen, and I know I'm going to hear a lot of flack for this. God did not make religion. Man made religion. Okay? And I keep telling people, who's going to go to heaven? Who's going to go to heaven? The Baptists? The Buddhists? Who? Because we all do different stuff. So they always say, no, their religion say they can't use contraception. Their religion say they can't have termination. But you nearly died. God will provide. Okay. Now, we as doctors, we can't force you to do anything, right? We can't force you to do anything. But sometimes common sense can take you a long way. So we get to the point where, hey, legally, we have to do stuff. We got to talk to you. We have to make sure we don't get ourselves into trouble. We have legal team to come and tell us we can't go beyond a certain boundaries. I can't report the partner. I can't tell her what to do with her partner. I can't put her life in jeopardy, or I can't do something that will make her get into trouble in her house. So we have a fine line because the patient is a patient. She's a human. She's coming for help. We're not gods. We're here to help them and help them the best that we can. But we can't think that we are better than everybody else and know what's best for everyone else and do what we deem is possible, you know? Because I mean, think long ago, they used to have, right now people have tubal ligations, permanent sterilization. They sign a consent and then we can't touch them for 30 days. And then they have from 30 days to 180 days to get the procedure done. And if they don't get it done within that time, they got to sign a new consent. Now that was enacted because long ago, there were a group of people who thought that she should not be having kids. You should not be having kids. At first, it was the whites versus the blacks. So a lot of the black women were, unbeknownst to them, were sterilized. And then we had some of them, like people who were medically handicapped, physically handicapped. They would be sterilized, again, not knowing what was done. So this is what was enacted. So we have, legal ramifications. So some of the legal hoops that we have to jump through was enacted for protection for the patient. So we a lot of things that we do just say, hey, we are doctors, but we know we have to follow the law. But there's sometimes we have to make the decision, if there's a mother that's pregnant and she's in trouble, but she doesn't want to have a cesarean, what do you do? If she doesn't have the cesarean, the baby will die and possibly her. So then what do you do? Right? So we have all these sort of ethical questions. This is way before Roe versus Wade. So we as women should be in control of our bodies. But we know, at least as OBGYNs, if it comes down to that, we usually try to save the mother, right? And that's usually where our head is. We're going to save the mother. If it comes down that it's between mom and baby, but the mothers would never, ever agree to that. And we're like, no, the goal is we got to save mommy, right? And a lot of the times we need to say, hey, we need to section you. Family will sometime rally around and it can get it to change. But the law is always going to have its looking over our eyes. If we don't even have the law, we have our own governing board. Like the American College of Obstetrics and Gynecology, we got to answer to them when we do silly things. So, why'd you go in and take out this lady's uterus when she's only 20 years old? We don't just operate blindly. We have to answer to a lot of ethical boards so that they know that we're not just some sort of like maverick out there just going, hey, there's a uterus, I'll take that out. Hey, there's a baby, we're going to take that out. We have people that tell us this is stuff that we can do within the guidelines, and we just sort of have to make a decision that this is for the best of the people that we're taking care of.
I think one thing that I liked about what you said, and this is a saying that like I find myself often saying, is that I find it interesting how, you as a doctor, when you're actually in the field and you're the one being, making those decisions about what best to do for the patient's body, I really find it just interesting how the law doesn't support what you as the person doing the procedure, who's educated in the body and actually knows what's the best, procedure, the steps to take with that. It always baffles me as how people who aren't in the kitchen or in the pot making decisions.
Well, you know what? It's the thing with the heartbeat law, which is why they were having the problem. Because a lot of the times, women don't know they're pregnant. And so how are they going to have the termination? By the time they find out they're pregnant, there's already a heartbeat. So it's kind of like, well, yeah, you didn't find out soon enough that you were pregnant, so you can't terminate. And it's just, you got to think about the quality of life for this person. And I'm assuming this patient knows what's best for her. Now, granted, we have people who are in the extremes. There are people who always abuse the privilege. Because we have people who've had multiple terminations. You kind of go, hey, what are you doing? You're making it bad for everybody else who actually needs it. But there are those people who actually need this. You are 16 and you make a mistake and you're pregnant. You should have to live with this for the rest of your life. And that's what they're saying. Yes, you should have to live with this for the rest of your life. When I go into work on Saturday, because Saturday is usually the one day where we see the protesters outside with their big signs, and they're talking about God loves you. Yes, God loves me. But I have to carry this child. I have to decide if I'm going to be able to feed and take care of this child or have the other kids. But people are always making these kind of decisions about, well, you should have known better, or you should have done better. You don't know what they did. They could have been on the IUD and had the pill and had the condom, but they got pregnant. Mm-hmm. So you're telling them that, hey, you have to live with this. We make mistakes in all sort of facets of life. So my question is, what makes something that they're God, that they should tell me how I should live my life, and I can't be my own God for my own body?
Mm-hmm.
It's interesting. We actually recently had an all guys episode called The Shop, where guys weighed in. Our co-hosts Quentin and Justin, they weighed in with some guests on this topic. And, I'm interested, Justin. What do you think? I mean, from your perspective, is there anything that she's touching on that you guys maybe were curious about or didn't understand or anything like that?
Well, I will definitely say, we're only 30 minutes in. I've learned a lot of things that I would have never, ever, ever, ever known about just some of the things I even go into delivering babies, some of the things that go into contraceptions. There's all these different things that like guys don't know about. And like one thing that it makes me think about is while we really had an insightful conversation about like how to be better allies, the area that we sort of didn't really address is just the lack of knowledge that comes with a lot of the things that you guys have to face with carrying babies, and then the issues that you have to carry with deciding, like, if you do want to terminate this baby. So something that I feel like this conversation really highlights is, and that I really want to name, is that in the same way that we're in this ongoing right to make sure that women have the rights to make the choice about their body, there is, and despite me being a gay man, or despite me being a black man, as a man, just the same way that there's white privilege, I have a privilege of just feigning ignorance. And it's a practice that I've realized that, even though, we talk, in the episode we talk about like how it's important, how this affects like our moms and our sisters, our girlfriends, our cousins, or whatnot. We talk about why it's important to be more vocal. What we didn't really address is that it's important to be just more educated. And for us to even be able to have the education to fully understand why this is such a big issue, what things go into it, why we should really be advocating, because there's so many thoughts and emotions that go into it. I mean, Dr. Meikle brought up the example, the 27-year-old and a 15-year-old. And, we often talk about the experiences of, the 15-year-old and all the things that, affect her decision. There's all this, well, she should do this, she should do that, she can't do this, she can do that. Meanwhile, the man gets the benefit off of being a man and not really realizing what this 15-year-old is going through, or even being by her side as she's going through it. So, like, definitely, like, it's brought me a better clarity within myself, just to just be more open to some of the things that we go through. I mean, like, we were talking offboard. I was telling how my mom, she just has this, she always starts with this conversation, like, who are you to tell me about what I could do with my body if, like, I can die carrying this baby? And while, like, I've always understood the gravity of what she was saying, I fully understand the weight of what she was saying after this conversation, because there's just so many things that, like, I don't know. And it's because I benefit from being a man and not really having to know these things, because it's an experience that I just don't have to deal with or know.
Well, you know what? I understand, but there's also a different avenue. Sort of the economics of everything too, because a lot of the times the not having the pregnancy now is that it doesn't fit into the economics of everything. Women, we also have to deal with every time we get hired by someone, look at us and go, I wonder if she's going to leave, get pregnant and leave the job, right? So we also have to deal with oh my gosh, I just got this job. Am I going to get pregnant too? People saying, well, that's not a choice because it's God's choice. And I understand all of that. But we also have to deal with a lot of the times it's just us. Now, granted, there are a lot of two-parent households, but a lot of time it's just us. And having a child right now, meanwhile, I'm not going to be working for the time that I am on maternity leave. And sometimes I may not even get money for maternity leave. And once this child is here, now I've got to deal with babysitting fees. Everybody's worried about this unborn child. Oh gosh, have this child. You should love this child. This is a human too. So the father's going to start to pay child support from the time you hear that I'm pregnant, because you're not considering it a child then, but you're considering it a child when I have to be responsible for this child, right? Now, once you leave this child out, I guess, into the world, you don't have to deal with I've got to get home, cook, care, clean for this child. So it's not just the medical aspect, it's the whole society stuff, because now you've got to deal with this child and you may not be ready. So then what? Send the child up for adoption? Also, sometimes the problem is carrying the child, because some of the jobs, they're hazardous, so you can't do it while you're pregnant, or you already have the stigma attached to you when you're pregnant. So it's kind of like, well, yeah, I can give the child and give it to my mother, but you have to deal with what can you handle emotionally right now? What can you do? And a lot of the guys can walk away. Mm-hmm. Even if they are the best guy, they may claim to love you. They're going to do what's best for them. Mm-hmm. And a lot of the times, not that they didn't care for you, but their lives are going to move on and you're going to stay a little bit stagnant. And again, we have extremes. You have people, I've known people who, one of the girls in the residency program a few years ago, she had a child when she was 15, but she was now a third-year OBGYN resident. I'm like, oh, girl, you do. And she was Hispanic. So it's like, yeah, people can do this. But sometimes it's what holds you back. And we should be able to make that decision. People have been saying, well, What is it fair to the guy that he has this woman now that he thinks he's going to build a family with, and then she decides to terminate his kid? Well, you know what? They two should sit down and have a discussion, because that's not my discussion as a doctor with you. That's you guys' discussion, what you're going to do, right? The same way how she thought she was going to have a partner and you left. So now why can't she be pregnant with this child and decide she can't do this now? You guys have the discussion. Don't blame everything on us. But this fact that we get to choose what we do with our bodies, we shouldn't have that stifled by someone thinking that they know better than us and they think we should do what they think because they think it's best for us. And I don't understand that. Why is it best for us?
I think that was something that thankfully we did talk about within the episode. We really tried to articulate just how important it was for women to have that choice, because that choice is what led to us being here. And I think what was really just poetic about that episode was that we had guys from different experience. You know, you had me, the gay man, Quentin in the relationship, Trey was single, and Vlad was married. And we all kind of talked about how women played a role into the person that we are today, and just how, you know, there was just that lack of understanding and, you know, what ways we can show up for them, why it's just often taboo for just to even have these conversations. Like, that was an area that at least me and Quentin, we really wanted to make sure that we brought people together to really have that conversation, in hopes that we get other Black men to kind of talk about it. Because we talk about protecting our Black women, but this is an aspect of protecting the Black women. And this is an aspect of really just showcasing how, you know, their battles are really our battles in a way. Because like you said in the beginning, like, it's more than just, you know, about reproductive rights. It's an economic, you know, issue. It's a poverty issue. You know, this is really just impacts our community as a whole. So I definitely appreciate like just what I'm hearing today. Like, it definitely like makes me want to come back to that conversation, like with just a more heightened lens, and really dive deeper into, you know, the things that really need to be said, or maybe even just some hard truths about just us being guys that we're not admitting to ourselves, and really just doing a better job of just having that awareness of these issues.
And thank you, Justin, for even bringing it back to the economic side, because I really wanted to highlight that. When Dr. Meikle said that, I felt that. So I just want to like talk about some law real quick, because she hit this point that I would feel really bad if we did not touch on it before this episode ended. But the Family Medical Leave Act allows for 12 weeks of unpaid leave after welcoming a new child through childbirth, adoption, or foster care. So think about that. That's unpaid leave. So you're not being paid for that period to say that you're taking care of your child because you have to, because you just created this new life and you need to build a bond and figure out what works for you. What's your lifestyle going to look like? That's 12 weeks, what, 3 months? 4 months, sorry. But then under the New York family leave law, employees it's not a guarantee, but they may be eligible for up to 8 weeks of paid leave. So let's say they get the 8 weeks. Then there's 4 weeks, a whole month that they're not guaranteed paid for. So it's like, I didn't really think of that before, because I always see people, oh, I'm taking parental leave, I'm taking maternity leave. Like, I never really thought about the financial aspect, that you really should put yourself in a position where you have money saved before you bring this child into the world, because otherwise there may be periods of time where you're not having any income unless you otherwise have other sources of income, which means you're depending on your partner then to pick up the slack because you can't work. Or you would have other businesses likely, or whatever else.
Passive income.
Yeah, passive income, or family that would help contribute. But that's a lot to place on the woman who's already going through body changes, hormonal changes. Like, so it's like, I've never been in that position. I'm not a mom yet, but I'm thinking about all of that. And it's like, wow, this is really weighing a lot on me just to even listen to and process, because with all that's going on in the world right now with inflation, like, you're adding on, let's say you decide to become a mother right now. That's a lot of responsibility. Like, it's not just, oh, 1, 2, 3, you're pregnant, cute baby shower, and that's it. No, this ain't a game.
You know, and it's like there's so much hoopla around, you know, trying to regulate a woman's body, but there's no regulation of like how we support a woman deciding to carry this baby. Like I like it's baffling that there's laws in place to offer a woman time to spend time with the kid and nurture the kid, but like being able to have the finances around nurturing these kids is an important aspect. You know, if you're going to tell me I have to have this kid, but not even allow me to have an income while this kid is in the early development stages, you know, where's the win here?
Well, the win is that you have a cute bundle of joy.
Right. That's
besides that.
I mean, you know, think about it. We had a formula shortage earlier this year. I mean, I know so many new moms who were like trying to figure out where they could get formula. They could, and one of my closest friends right now, I mean, she's in the process of, her baby is nearing towards the age of 1, and he's strictly breastfed. Like, he will not wean, like, he doesn't like formula. But he's starting to grow teeth. So she's trying to wean him off of the breastfeeding because that's not pleasant anymore. Like, you know, and it's just, I really believe that if men truly, and of course, the fathers who are present and they're supportive partners, all kudos to you guys, kings. But for most people, when you think about it, the woman is the one that has to deal with this issue from when she finds out that she's pregnant for the rest of her life. Like, there's no cutoff, like, for the woman.
And she's like, dealing with it much longer because for the woman, think about with the women, you start to feel different. You maybe missed the period. So in your head, you're kind of like, even before you even utter a word to Mr. Man, I wonder if I'm pregnant. Okay, maybe it'll come tomorrow. It didn't come. You may even suspect. You might even go buy a test. This is a week, 2 weeks before even you utter a word to him because you don't want to get him started until you know you're for sure. And then you may find out. So you've already been processing for 2+ weeks. Then you go and tell him, I think I might be pregnant. Then he starts to panic and freak out. So now you're worried, oh my gosh, look at how he's responding, you know? And so it's funny because we deal with this a lot longer than they have dealt with it. And plus we have this being growing inside of us. So we usually have that bond already because by the time we tell him we're pregnant, we already come to terms with the, oh my gosh, whether it's, oh my gosh, or oh my gosh. Right. Pregnant.
Yeah.
We already processed some of that. So, I mean, for us, it's more of an emotional roller coaster because you guys come in, we bring you in when we're already on the tracks. The train has already been running. We've already been thinking in our head, something is going on, right? But it's very, very rare that the guy would turn around and says, you know, I think you're pregnant. He goes, no, I'm not. Yeah, the guy doesn't tell us. We tell them because we already know for sure. So it's kind of this emotional roller coaster that we have to deal with. We have to deal with the, where am I in my career, in my job? Some of them are in school. Oh my gosh, I can't have this baby now. It's right in the middle of midterms. It's funny. Some of the things that they think about is very kind of like, well, you know, people have babies and they still finish school. People have babies and still have their jobs. So that's not it. It's just that sometimes this is needed so that they can breathe. They can live the life that they want to live. But even so, it's still that woman's choice because it's still her body. I mean, when someone dies, you know, you just can't go harvest their organs to donate to someone. Right? They have to sign that consent while they're alive. So here it is, this dead body has more rights than that woman who's alive with the baby inside her. This dead person can say, hey, when I was alive, I said, no, I'm not donating any of my organs. So when they die, we are not allowed to touch them. So here it is now. There's no other use of those organs. But he says, we can't touch them because she didn't want that. But here you are alive going, no, I don't want to have this baby. And it says, no, you can't make that decision. And it's just kind of odd. We have no rights.
Very powerful, very, very powerful. And I did want to note, because there was this story about this Harvard law graduate that I think she was in the middle of taking her take-home exam for finals, and she started having contractions. And then she got an epidural, and then she was able to finish her exam. But like, she was basically going through that entire process of finishing finals for law school while being pregnant and about to give birth. So you're right. I mean, women truly aren't given the credit for what we can do, what our bodies can do. And I know a lot of people, they think it's like nasty to think about, like, oh, your body, this, that, but it's like, we're human beings. Like, there's nasty things about men's body too, you know.
Tell
Um,
you.
like we don't, it's like that's not a topic of concern, you know. But
It's not nasty. They're peeing and pooping on the bed, but hey, this is the most basic natural thing you will ever do in your life. I don't care what kind of a fancy movie star you are, I don't care what queen you are, and whatever you are. You could run England. You're gonna be on that bed, peeing and pooping on the bed as you push this fetus out. It's
wow.
very, very earthy. This is basic, back to basics. Hey, this is all it is.
Mm-hmm. I was gonna ask Dr. Meikle, so as a seasoned professional who's seen this time and time again, how can men be better allies to women in this process, in your opinion?
Well, one, they can start by talking to the women around them and see exactly what they want, what they need, because sometimes they don't realize the stress that the woman is going through. The other thing is to not take away our rights and think that you know what's best for us.
Most important.
We are grown, educated people. I mean, we can own property now. We can vote, you know? So we're not silly, stupid, dim-witted people. We can tell you what our body is going through, and we can tell you what we think needs to get done. Now, if they're concerned that we're just going to go have sex and terminate babies, like I said, there are extremes everywhere. But you're trying to do this for mainstream America, basically. Mainstream women, not just for those who just want to use this as, hey, if I have sex with him and I'm with him and all of a sudden I don't like him anymore, I'm going to terminate. Because people do strange things, but that's not what we're focusing on here. We're not focusing on those. We're focusing on mainstream America. Men, you guys basically try to support women in the sense to talk to them, find out what they want. And don't be so quick to make decisions about what we should do. I mean, we have insurance companies that will pay for Viagra, but they don't pay for contraception. So I'm just kind of like, hey, what are you guys thinking? And a lot of the things is that, I don't know, I still think it's a matter of control. I just think it's a matter of that if they can control when we have the kids and how we have the kids, it's more ammunition, and it's just more of a heavy hand that they have to control our lives, whereas we can't control our lives. I mean, we're educated now. There's a time when women couldn't even go to school, right? It's just the more they know, the more they get concerned. We're not here to try to beat you down or to surpass you. We're just trying to survive like you guys are. But a lot of the times, we're not trusting of the men because they up and leave. They up and get a more sleeker model, you know, and they leave us with the kids. So a lot of times when we make our decision, it may be selfish, but it may just be that, hey, we are trying to survive. We're trying to deal with the kids that we already have or the situation that we already have because I don't trust you. And sometimes that's the problem. I don't know how we're going to make us trust men more because they're going to do what they're going to do. Not to say there are women that shouldn't be trusted either. But a lot of times we do what we do because we know that we can't trust this guy to help us through this. So we know, we may like you, might be Mr. Right now, but we know that we can't have a long-term relationship because I don't trust you to have your child and to find that you will provide for me and the child.
I want to talk about one critical point, which is the fact that in America, Black maternal mortality is about 2 times, 3 times higher than other counterparts. Why do you think like that is? Like, what are the causes that could lead to that with Black mortality, maternal mortality?
Well, as I spoke to you guys before, when I did residency, I did it in a place where basically underserved. Actually, I'm still in an underserved region. A lot of times they don't have the resources to do the studies that need to get done. And sometimes too, they just sort of negate what you say, you know? Not to pardon the men again, but sometimes, you know, like if a woman complains to a guy that she's in pain, they say, it's nothing, you can bear it. So sometimes when you're a minority and you walk into these places and you tell them, oh, I have a headache, they don't think it's real. It's like people don't think PMS is real. They think you're just faking it just to get empathy or to get out of work, that it's a real thing. So sometimes they negate it to the expense of the woman's health. So she doesn't have the resources at her disposal, and sometimes they don't believe her. And it's a big thing where you have to fight them. Plus, you know, we are living, again, in economic times where we have to work harder and longer we go home and we're sleeping maybe for 3 hours because we got to get up early, ride the train for 2 hours to get to work, to get back home, to now we're eating a substandard meal. So just the way that we're living isn't conducive to a lot of health. So a lot of things are headed our way. Look at the hypertension, the diabetes, our diet. Sometimes we just don't know about it, but we're more prone to that. So it's also going to come through in pregnancy. And I tell my pregnant patients all the time, listen, when you are pregnant, your body is at its utmost as far as stress is concerned. So if you are someone who's going to be diabetic in life, you're going to be diabetic when you're pregnant. If someone's going to get hypertension, you're going to be hypertensive when you're pregnant. If you are someone that has any kind of ailment that causes any kind of demands or stress on the body, it's going to show its ugly head while you are pregnant, right? And sometimes it shows it later in the pregnancy, sometimes earlier. Earlier in the pregnancy usually means you're probably going to be bedridden, you're going to be off of work, and we can't stop our job because we're not going to get paid. So what ends up happening? We end up suffering from the complications because we can't manage it, because we don't have usually the location that has the resources, and the patients themselves don't have the resources to take the time off to go get the care that they need.
Wow. Wow. Like, I'm really speechless because it's like you said, Justin, it's a lot of weight. And hearing this as a woman and recognizing, because some of these battles that Dr. Meikle is mentioning, I have not yet faced because I'm not there yet, because I haven't reached that stage, but I can definitely relate to some of the things that you're talking about with respect to just hormones. Like, one of the things that I think is interesting, me and my mother always connected because she would always be like, oh, your period must be coming. And like, someone else might think that that's funny, but no, there's the serious things such as PMS. And I am very much more irritable, like in that stage. Like, I've become very irritable and just easily irritated very quickly. And I think my patience goes down. And it's literally hormonal. Like, it's not like I'm doing it for fun. Like, I just want to get a rise out of anyone. But no, the body really changes during certain periods. So it's just, and it sucks.
Well, the breast gets sore. You have pelvic pressure and heaviness. So you don't feel wonderful. Your clothes don't fit. Now something that you had on yesterday is now tight. So you just kind of, when I had a sore tooth maybe decades ago, and you realize when the tooth is sore, anything that touches hair, oh gosh, it's like somebody slapped you in the face. So it's kind of the same thing. When you're at the sense where your breast, you can't even have the shirt touch your breast, and then somebody wants to come and touch your breast, like, whoa, you don't understand what's going on here. They truly don't understand.
Like, leave you alone.
You have the pelvic pressure and you're feeling this heaviness, not the pain, but this heaviness where it's like, you're not in pain, but you don't feel wonderful. You can't skip down the street. You got to walk and make sure you step, and they want to come and joke with you, and it's like, listen, we're not having this today. And they think you're just being,
dramatic. Yeah.
And it's like, no, I'm feeling this. I am feeling this. And sometimes you're just waiting for the period to come just to go like, oh my gosh, can we get this over and done with? Or you get the munchies. So now, I don't want a steak dinner. I want some M&Ms, kind of stuff. And they don't understand this.
Yeah.
So it's kind of like, it's a lot of it's hormonal, but you have to learn to deal with it. Also, people, it's kind of like, if your culture sort of like supports that, you're going to play into it more too. So it has that aspect to it where it's like, you got to get to work, girl. You got to go. Like, you see now, I have a cough, I have a cold, but I know I have to do this, so I will do this. I could still be in the bed. Girls, I will see you later.
Yeah.
I will see you, because I can play into that. But I know, because I guess you've never heard me before, but I do sound nasally and congested. But I'm like, yes, I'm sick, but I know I got stuff to do. But still, only push me to a certain point, because I'm going to go, no, I'm sick. I'm already here on the border and I'm going to go over the edge. So yes, leave me alone. And people don't understand this with the hormones. So throughout your life, your hormones are going to change. And throughout your cycle, your hormones are going to change. So it's a lot you have to contend with. Guys don't have to deal with that.
And I wanted to ask you a question about that, because a lot of times even women will be generalized like, oh, she's on her period, so that's how they act. But women actually have different symptoms. Like, not everyone experiences the same symptoms, or as you said, like their hormones, it's not all the same. So I wonder, like, how can we, I guess it's on the men, right? Like you said, to do the research and figure out, because how else do you educate them with respect to this subject? every woman is going to have a period for a certain amount of time of her life. So I mean, but to ignore that issue, or to go like be completely ignorant to it, it makes no sense, because you're facing women who have either had a period at one point or they're still having one. So
oh please, the menopause is even worse, because the hot flushes, the night sweats, it's not easy. So it's not as though once the period stops that you all of a sudden return this. No, you got other issues. I keep telling people this. I said, you know what? We got to read that contract that we have with God, because something is amiss here. I think the only thing that happened was that Eve said, here, take this apple. He took a bite. Where was it that says, it just says that the snake will walk on his belly and we should have pain in childbirth. Where is this hot flushes, night sweats? Where did that come into the contract? Huh? When did this come into play? When is this pain we're going to have from, from the time we hit menarche to menopause? I like, somebody needs to read that contract. So you are the attorney. You need to go find that contract that Eve had with God and rewrite that, because we need to get some amendments in there. I'm like, no, this is not right.
It's interesting you say that. I have a friend who I always try to teach him how to treat women better, because my family was mostly women. So, like, for the record, like, PMS does exist and women are hormonal. I have seen all sides of it. I have seen menopause. These things are real, men. Please note that. But I try to teach him, because he's like always trying to understand how to be a better guy. I kind of take him as like my little brainchild. He's like my son in a way, because he just needs help. So I always try to teach him whenever he's having, encounters with like women that he's getting to know or he's dating, and whenever he's like always approaching it from like the macho man approach. I'm like, dude, like, I need you to like break it. I need you to literally simmer down and understand, like, you have to see it from a woman's perspective and understand all the things that they're going through. Like, they go through things that we benefit of not having to deal with and go through. And like, I like the example that you use with the Adam and Eve, because one that I use is, let's say that let's say that somebody entered you and left their child in you, and you had to carry this child for 12 months and then figure out like how to give birth to this kid, and you have no crevice to give birth out of. So what are you gonna do? I always try to paint this picture for guys to get to understand. Like, let's say you had to carry this child and we have no crevice for this child to come from. So what do you think that they like? How do you navigate that? Like, and that confusion and that stress and that thought is what women go through when carrying children, and having to think about all the implications that this decision has for them. Like, I always try to really paint this picture for men. Like, if you take time to understand the gravity of what they're saying, and like, I'm gonna watch this Adam and Eve example you gave me, and I'm gonna try to incorporate it with like the guys that I meet, because that is just like perfect.
I say we got the short change. I know we need to get some female attorneys. I'm like, no, this was Adam and God talking up there. I'm like, yeah, whoa, hold up. And then they had 2 boys right after that. I'm like, no, we need to change this. Something is going on here. What's all this PMS thing that we got going on here? What's with all this PMS? What was all this menopausal stuff? Wait, what? Now we got men who dictate what we're supposed to be doing? Okay, hunter-gatherer. The men went out and hunt. Women stayed home and took care of the village, gathered everything, cooked. They were running the societies. It's just when men got back in, because now you don't have to spend all day hunting for the buffalo. Now they want power. Whoa, hold up. Mrs. Smith, she's the one that's preparing the meal. Mrs. Jones, she's the one that says that we should have this table here. Everybody's the women who are running the society, because they were the one that was there. Men just went off to go hunt, and they did their men stuff and come back in. Now they want to say, hey, no. We can't cook those berries today. Whoa. Hold up. You go kill the buffalo and bring it back, okay?
So before we head out, I definitely wanted to just ask, how do you not let the politics enter into your practice? Like, medicine, it's just evidence and science and applying science. So how do you not get bogged down with the politics, and like, what drives you to just do what you do each day?
Well, I kind of know. Well, it's one thing I tell you. I'm a doctor. I know what I need to do as a doctor. Now, you can't tell me how to doctor, right? You can't tell me how to doctor. I know I need to see the patients. I need to ask them what's going on, see if I can help them the best that I can, and follow up the best that I can. So I do that. anything that falls out of the realm of, oh, we need to do A, B, C, or D now, it's like, well, how is that affecting the patient? So for me, it's not that difficult to do. Like for me to take someone to the hospital to do a surgery on, I still have to get the authorization from the insurance company, but I decide to take them to the hospital or not take them to the hospital or refer them to someone else. So for me to decide what I'm going to do, that's already been done. That's been cast in stone already. I'm the doctor, I'm the OBGYN. I know how to treat you as an OBGYN. When they come and tell me now I can't do a termination on you because now there's a heartbeat, I'm like, really? This hasn't affected me. Again, I'm here in New York, so it doesn't affect me that much, but it gets to the point where you have to say you got to do what's best for the patient. And again, I invoke, first, do no harm. Treat the patient the way that you would like to be treated, and usually things go well. Even if they don't turn out wonderful, things will go well. I'm not trying to scam you. I'm not trying to get rich off of you. I don't live on lobster and caviar. I'm just trying to make sure that you are healthy, that I am doing okay, that I can get up in the morning and look in the mirror and show myself and go, yes, I am the doctor. I'm going to go in. I'm not here trying to pull any scam on you. I'm going to be working probably until the rest of my life. Listen, with all the debt that I have, and I'm like, listen, I have things to do, but I'm not here trying to cheat you. And I'm not looking to try to cheat you. I'm not trying to become millionaire Dr. Angela Meikle. I just want to be Dr. Angela Meikle and make the world a better place as far as I'm concerned. Let me do my little part. I have my 4 kids, and I'm going to take care of the patients. That's it.
Thank you so much for all of your wealth of knowledge and everything, and taking the time to speak with us. We appreciate it. The Taking Chances podcast. We are so grateful to have you. This has been such a pleasant experience. Justin, do you want to say anything?
I mean, like, I am leaving this episode with just a greater knowledge. I am leaving this episode with just a lot of just insight for things that I didn't know, and just leaving it wanting to make a commitment to myself to just be more educated and be more aware, and just to really just continue to do my part to be an advocate for what's right. This conversation really just highlights the work that still needs to be done, but also, like, I feel like, within the series that we've done this season on this topic, I really think that it's offering an insight that we just aren't seeing a lot of, and it really just speaks volumes to have a doctor who is in this field and taking on this charge and just really actively just cares to do just the good work of this charge. So, like, I definitely am just so appreciative just to be in this space and for the learning, and just wow.
Yeah.
But we usually do one fun thing. We usually ask our guests one fun question before we close the episode. So my fun question for you is, if you had the opportunity to go to medical school all over again, would there be a different path that you practice?
I think if I did anything, it's also a toss-up between this and emergency care. This is probably the difference. Still wouldn't be pediatrics. And it's funny because at the point I had the 4 kids, I'm like, no more pediatrician stuff for me. But I think if I had to change my path, I probably maybe would have done emergency medicine. And that's about it. But this, I don't have any problem because I love my patients. You have, I think 95% of the patients are just wonderful people. And you have those 5% that go like, why? But I love my patients. I think my patients are very wholesome people. Most of the times they have common sense. They do have those that grind on you, but I love my job. I love what I do. I may not love the politics around it, and I'm not one of the political person in my field because I don't do the marches and the stuff. My boss actually does that. She marches, and because she's one of those primaries. She started way back when, so she's actually a very, very proud proponent of the women's rights because she's one of the founders of the women's rights. But I'm not one of those political person. I want to be able to do my job. What I don't like is that when when the administrators come down on you with things that are like, you guys are just nitpicking. Can I be the best doctor that I can be? And I'm happy because I love my job. Even with the terminations and the patients with their drama and the men coming in with their issues, and some of them are just, you don't know what kind of education they got because some of them don't even understand how they got pregnant. Yes, true. You think it's fake. Some of them do not understand. I have those that don't know how to have sex, if you guys can understand that.
I understand that.
And I'm talking about you're 25, 26 years old, because in their culture, they don't teach the sexual education and it's kind of forbidden. And so they don't talk about it. So I'm like, oh my gosh. So I like those. I like my teenagers because I like to tell them, listen, guys, sit down. I don't want to hear about how much you love him. Okay? Because you are only 16 and that's going to change. Even if you stay with this person, please do not throw your life away going, oh, I love him. I love him and he loves me. Oh, I got to have sex with him because otherwise he'd have someone else. Sister girl, I was there. When I was 20, you couldn't tell me anything because I love this man. Okay? You're going to grow up. And I tell him, I said, you see all these gray hairs? I got these and I can tell you something. So you shouldn't have to go through the same mistakes that I've gone through, but you got to live it. So I love what I do. I do. Plus, I also get to read. I get to learn some of the cutting edge stuff. So I don't know. I think the only thing I would change is if I didn't do obstetric, I probably would have done the emergency room.
Well, for the record, doctor, some men don't know how to do it either. Just saying.
And these are the ones that are educating the men. I'm talking about they didn't know anything. I'm just like, what? Sometimes you just kind of go, you stop and you close the door and you're like, what? They don't understand. And what I find interesting about the guys, and I just tell them, I said, listen, this 16-year-old doesn't know how to make love to you. He knows how to have sex. He may know how to ejaculate, and he knows how to go tell his boys that, yeah, he scored, but he doesn't know how to make love to you. He doesn't know you to make love to you. He's not going to learn for a while because right now it's all about him. He's not that he hates you. He doesn't hate you. He may truly care for you, but he doesn't know how to make love to you as a woman yet. And you don't have the assurance to ask him and tell him you may not even know what you want yet. So you guys, you're growing with this. So don't think this is it because they all think that they know everything.
And on that note,
read my sex
book. For those who are listening, if you haven't already, be sure to subscribe, share this video with a friend, comment on it, like it. But your Taking Chances family is out. Bye.
Take care.